Hi everyone, this lecture is going to be on abnormal neutrophil morphology. Toxicity is a morphologic change that is observed on microscopic blood smear evaluation of neutrophils. It means that the neutrophils have undergone a shortened maturation period due to either an increased demand for neutrophils or direct toxic injury to neutrophils, such as in sepsis. In either case, the most common cause of toxic neutrophils is inflammation. The three most common signs of toxicity are shown here. Compared to the normal neutrophil at top, the neutrophils at the bottom display increased cytoplasmic basophilia. Also, the two neutrophils toward the right have focal aggregates of basophilia, and those are called Dolly bodies. The neutrophil at the far right exhibits all three signs of common neutrophil toxicity, with the last one being foamy vacuoles in the cytoplasm. So foamy vacuoles. In general, the more signs of toxicity that are present, the more severe inflammation the patient has. Band neutrophils are one stage earlier than the mature segmented neutrophil, so segmented. The presence of band neutrophils above their reference interval is called a left shift, meaning that there is a shift towards immaturity. So compared to the segmented neutrophil, the band neutrophils have roughly parallel nuclear borders all the way around the nucleus, so there are no pinches. The most common cause of a left shift is inflammation. Hypersegmented neutrophils are neutrophils with greater than 5 segments or lobes to the nucleus. These are either geriatric neutrophils that have prematurely aged in circulation, or they are dysplastic neutrophils. In the case of Cushing's disease or hyperadrenocorticism, the excessive cortisol inhibits the neutrophils' migration into the tissues. So the neutrophils remain in circulation longer and they age in circulation. So this is an aging change in the case of Cushing's disease. The presence of hypersegmented neutrophils is also known as a right shift if you see it in blood. A variety of infectious agents can be identified in circulating blood neutrophils, but for the purposes of this class, you will only be responsible for identifying rickettsial infections. Rickettsial infections are diagnosed on blood smear by identifying intracytoplasmic colonies of bacteria, and these colonies are called morula. This is indicative of either an Ehrlichia infection or an anaplasma infection.